I will be co-moderating The Real World, Translating Genomics into the Clinic. This session is really largely highlighting a number of ELSI studies looking at the ethical, legal, social implications of genomics and genetics research. Some of the topics will be views on broad data sharing, the views about receiving secondary findings. A really interesting topic will be the views about receiving or not receiving non-actionable secondary findings. I think one thing that we're really increasingly trying to get our hands on is whether indeed actually using genomics in the clinical setting is actually more cost-effective than not, and what the downstream cost effects might be on the healthcare system at large. I think another really interesting question is what to do with all these data and how to integrate these data into our existing infrastructures, the electronic medical record, how to make sure that primary care physicians, who in some instances are going to be really largely kind of handling the data on a day-to-day basis with their patient, especially in the context of the otherwise healthy patient, that they're comfortable using this information, know when to seek expert advice, and yeah, just know when something is important to follow up, and know when they're comfortable saying, you know, this is, I think, something we don't need to worry about. Well, what I hope attendees gain from this session is a real appreciation that translating genomics into the clinic is more than just about the technology and the science. There's a lot of these kind of practical, psychosocial, ethical policy issues that we really need to be attuned to if we're really going to successfully move to kind of complete, smooth integration of genomics into the clinical practice.